welcome from my side, and special thanks to Eleni for the kind introduction. And yeah, I'm really looking forward to our session today, and I'm very honored to be here and very pleased to be here to give this presentation on climate change and health. And I'm also very grateful to the organizers to place this talk at the beginning of a conference. Normally, it always takes place as a very last session when everybody has left and the cleaning people has taken over the conference venue. So I'm really happy to take you on a journey today to show you and rephrase the climate challenge we are currently all facing and find a new narrative on it. And I really hope that you will enjoy it. We will delve into various subjects. So currently, why now? Why do we have to act now? Why can we not longer postpone it to a better time that will never come? Then I also would like to give you some examples of really climate leader and climate leadership worldwide. And we need, and that's a new narrative, we really need to imagine a healthier and greener world. And that is something what we are currently not doing. Then I also would like to highlight climate change and health. That's very important for us as health professionals. But it's also important that we engage, and we also need to know how to communicate the climate crisis, and we are still struggling with that. Then, as one of the last topics, we are also actors and we are also culprits. We are actors in helping patients to overcome climate impacts, but we are also creating a lot of carbon emissions as healthcare professionals. And in that respect, we are also culprits. And this has to be taken into account, and we also need to act on this. And the last question is, what is going to happen when you're leaving this venue, when you're leaving the room, when you're leaving the conference? So what do we need to do? So about the urgency. I think most of you are aware of the IPCC reports. The IPCC is the Intergovernmental Panel of Climate Change, and this is a multidisciplinary group of scientists worldwide that come together and contribute to the evidence of climate change. And the Intergovernmental Panel of Climate Change always publishes reports, but also summaries for the one that do not want to go in depth into it. And there are different pathways they have highlighted. And the one pathway is a 1.5 average temperature increase, the Paris pathway in a way. And average temperature increase, I think we also need to know and understand that means average on the planet. That doesn't mean that, for example, Antarctica heats up already above 2 degrees. And there are not other spikes worldwide, but the average increase is 1.5. Unfortunately, there is little evidence currently regarding the politics that we can pursue this or currently pursuing this path. That would be the best. Still, lots of climate disasters are going to happen, but it would be a livable future for all of us. Currently, we are more heading towards the 3-4 degree path, and that really means an uninhabitable world by the end of this century. So to put it in a different perspective, all the children that are born today are at that time 70 years old, and they will go through all the notion of the severe climate crisis. The WHO has already highlighted it almost 10 years ago that the climate crisis, in fact, is a health crisis. And it will affect mostly us as citizens. And there are also different scenarios. You can see it here highlighted, what's going to happen when we follow the different pathways. And the different pathways have different impacts on the health of people. And then there's also this scenario, what's going to happen with our planet and with our Earth. And we are at a fork, at a junction currently, seeing what's going to happen. Are we going to stabilize the world? And that's still our option. I think that's the opportunity we still have got at the moment to stabilize the world and create a better, greener, and livable world, or to create the hothouse Earth where there is no much life left. So we are all talking about the Anthropocene, when all happened about 120 years ago. And the Anthropocene really started in Britain and then rolled over Europe to the United States and then took over by globalization. And what we have seen a great acceleration of everything. We have seen the acceleration and exponentially growth of GDP, of energy consumption, of travel, and many other things as outlined in the figure. But we have also seen and experiencing now ocean acidification, deforestation, and the massive increase of carbon dioxide. And currently what we are doing with our lifestyle now, we are using 3.5 Earths currently. And this is not sustainable. And either we have the option to crash together with our Earth, or we improve and create a sustainable living for all. And that's the challenge we are all facing. But it's not all acceleration. As medical professionals, we are all very proud that we have improved life expectancies and treatments over the past decades. But there are dips now. You can really see it also in some European countries that life expectancy is decreasing now. We also, for example, see it over the last 3 years in Germany, that the life expectancy is decreasing. There are different reasons for that, and climate change will not improve the situation. There was quite an interesting publication in the World Economic Forum just very recently. And as you all probably love facts and figures, just wanted to give you some ideas, some notion what's going to happen. So 2050 sounds very long away, but in fact it's just 25 years. And when you look back, 25 years is not that long. So there's this calculation that floods, for example, could claim 8.5 million lives in the next 25 years. And we see it everywhere. We see it currently also in Florida. But Asia Pacific will be the worst hit region because it's very densely populated and also experience quite heavy rainfalls. Droughts, second reason, and the second highest climate disaster and probability will lead to 3.2 million deaths, with a huge impact for our health, and especially for children under 5 years. And there are currently quite a lot of really severe droughts, for example, happening in Africa. And that has an impact on resources, on water, on conflict. It creates a lot of conflict, but it also creates conflict for encounters between man and wildlife and animals, because animals are also looking for water and food and cannot find it, and will approach then more villages, and there will be clashes with the population and with people. Heat waves. Well, I don't know if you have it on your computer, but I see every day there's a new record of a heat wave or of your current heat in the city, in Athens, or wherever you stay. I'm currently living in Kigali. I see it every day. It's a new record. Yeah. So we are just hitting new records every day of heat. And that's quite disturbing. So heat waves could cause 1.6 million deaths within the next 25 years. And especially neonates, the unborn children, small children, and people over 65 years will be the most susceptible. And there are also high economic costs involved, about 2.1 trillion in lost productivity. And it's also something that's also very much neglected from our politicians to see that there's a downside to climate change. So in summary, in 25 years, it is likely to cause that we do have globally an extra of 14.5 million deaths. And there are specific vulnerable groups, young pregnant women, unborn children, elderly, and especially low-income people. Then 500 million are more at risk for vector-borne diseases, 12.5 million in economic losses, and 1.1 trillion, and I think that's very important for us, will be consumed by additional costs for health care. And these costs must be covered somewhere. And as you know, as a pediatrician, prevention is always better than cure. So we are still at the prevention state. We could prevent a lot at the moment. And then there's still this action gap. So global emissions must decrease also to come closer to the reach of the Paris Agreement by 7% annually within the next 5 to 6 years. But currently, they are still increasing by 1.5% today. Another challenge is that we are facing a triple crisis. We are facing the climate crisis. We are facing unprecedented biodiversity loss with a lot of species with a lot of loss of species. And we are also facing an environmental crisis with plastic waste and water pollution. There are different models that are used. And one of the models I've shown you is the IPCC model with the different pathways. Another model are the planetary system model. And this was introduced by the Potsdam Institute for Climate Impact by Johan Rockström a couple of years ago. And that recent report really shows that we have reached 7 of 9 planetary boundaries, with the ocean acidification rising. And the ocean is normally works as a carbon sink. And this is now saturated and becomes more and more acidic. And it also shows that our ecosystems are really interconnected and interrelated. And if one ecosystem collapses, there are several others that also collapses, coming to raise and approaching various tipping points. So what do we have to do? We have to do a lot. And we also have to change our economic models, because we cannot solve current problems with old solutions. If we want to find good solutions for current problems, we have to be innovative and have to apply different models. And a new economic model is the donut model. Maybe you have heard about it. And the donut model was developed by Kate Raworth in Oxford. And this model also takes the social components into account and our planetary boundaries. So we can really have a good economy if we act within our economic boundaries. And there are a couple of cities and even governments who are applying this model. And it's really working. I promised you to show you some leadership, good leadership, climate leadership and environmental leadership worldwide. And also what's going to happen there to the health of the population. And if that's really applied, really people thrive and the population thrives. And there is also this happiness index of nations. And that's also interesting that not only the richest countries are the most happiest one. So Copenhagen, you might have heard in Denmark, is the cycle city, if you want to go there. So they are very active in cycling everywhere they can. And I've stayed for 2 years in Paris after my postgrad degrees to do studies there. And I knew Paris as a very congested, very car-driven, car-centered city. And I had the opportunity to go there last year for a conference, and I was absolutely amazed how Paris has transformed into a cycle city. And even I was surprised because I never would have imagined that the Parisians, so attached to their cars, would change their lifestyle. And they did. So, and they're really enjoying it. When you sit in the streets and watch them, they really enjoy cycling the huge boulevards, formerly just for trucks, and car now closed are just for cycles, and they're full of bicycles. It's a complete different city. So whenever somebody tells you it's not possible, people can't change, they like the lifestyle. There are multiple examples that can just show the difference. Yeah, and then there are these magical parts of the world where you also have car-free islands. And I really loved car-free islands, and this is one example here in Greece. It's Hydra, it's very close to Athens, and it's beautiful to wake up in the morning without any air pollution, without any car noise, just with birds and the intense smell of nature. And that's a luxury. I think that's a luxury we are looking for, and we are having, not the newest iPhone. That's really the luxury of having the nature and more nature and happiness around us. I'm currently live in Kigali. I'm CEO there of a healthcare center that's currently built. And Kigali, that was also one reason I went there to Rwanda, is really an environmental leadership project. They're really running different projects, and one of it is a car-free Sunday. So once or twice a month on Sunday mornings, the inner city streets are closed, and that's taken over or managed by the Minister of Sports. So they are doing it for exercise. So they're engaging people to exercise. And they also had, for example, have awareness days, for example, WHO Health Day was a big thing there, and people really love it. So you can dance there. You can see me dancing there in the back with groups. You can meditate. You can play volleyball, and people really looking forward to have this car-free Sundays. And when in other countries we talk about car-free Sundays, they say, no, it's not possible. People don't accept it, but they are. And there's also one great thing about Rwanda. They really have equal leadership for quite some time. We have once a month the community day, Umuganda, and everybody is supposed to work and give 3 hours per month just for community work. And it also enhances community and the interaction and communication within the community. But that's also another reason why Rwanda is so clean. It's one of the cleanest cities, and Rwanda in general is one of the cleanest countries worldwide. It's always called Switzerland of Africa. And when you go there, it's really super clean. And they have also banned plastic bags since 2008. So when you arrive there at the airport, there are no plastic bags in your suitcases allowed, and you can easily live without plastic bags. And it's a huge difference when I see South Africa, for example, the impact of plastic bags and the non-existing plastic bags in Rwanda. It makes a difference. Yeah, and we can't forget Sweden as one of the other leaders. Stockholm will ban petrol and diesel cars from the city centers from 2025. That's next year. And there's a small revolution really happening in e-mobility. Every fifth car is now that's sold is an electric car, although it's mostly ignored also from our political leaders. But the world leaders are in e-mobility are China and India. Yeah, and there are also other examples how to build sustainable lifestyle, how to build a sustainable community, sustainable cities, also improve mental health by the Lancet Commission. Yeah, and also the IPPC was also endorsed and reviewed by WHO. So coming now to our next topic, climate change and health. That's very important for us. So this is a figure that just highlights the relation and the implication for rising, for example, rising temperature, extreme weather, air quality, vector-borne diseases onto our health. And there is a lot of impact on that. And I will go into more detail a bit later, but I just will touch on it because that's a huge topic. You can really lecture several semesters on this topic. And that's a WHO one that also shows the health risk, the exposures, the vulnerable groups, and the burden on our health system and health facilities. And climate change is specifically a burden where we in countries where there is already a fragile and not well-working health system. And climate change, just to give you some examples and some ideas, has an impact on acute lung diseases, chronic lung diseases, fetal malformation, coming from also heat stress, but also all the toxins around us, vector-borne diseases, malnutrition, preterm birth. Also, we did a study also even in Middle Europe, where you see that you have more preterm births because you have hotter nights in the summer and the women cannot relax and they really have stress during the night to sleep. And that really can build up depending on your social economic factors around us. When you're, for example, living close to a noisy road or have a difficult environment, can really lead to preterm birth. It affects diabetes 1 and 2, definitely has an impact on obesity. I think we have seen it all in the COVID crisis that our children, but also adults, didn't exercise any longer. And the hotter it gets, the lesser we exercise. We more stay inside. We are more occupied by our cell phones, and that's not good for our health. So it has also an impact on our mental health. Because the loss of our environment, but also increases injuries and definitely emergencies. Yeah, we in spring we also published a study on this and series of publications. The impact of climate change across the life course, and it's quite interesting to read. Did it together also with some WHO colleagues and highlighted the impacts of climate change on different life courses under the current scenario and future scenarios. And if you're interested, this is the publication. So going to heat waves, as mentioned, as they have quite an impact and are one of the main climate disasters. So we are going to have, and we're already seeing it, an increase of heat-related morbidity and mortality. There are currently lots of publication also available on heat waves. So we definitely need better heat emergency plans and early warning systems, also in middle and low income countries. Some high income countries have taken it up, but not very well. There are definitely those vulnerable groups I've mentioned. And there will be more hospitalizations, for example, for chronic patients with chronic diseases. For example, with patients with diabetes, for renal diseases. And this is also a high burden for our health systems. And the high risk are, again, the low socioeconomic groups, low and middle income countries with already fragile health systems. Yeah, we are also getting used to this. Yeah? I think you here in Greece are getting used to your wildfires. In Europe in general, definitely the States, Canada, Australia. And I've experienced that when I was working at Grotescure Hospital in Cape Town. That's just located here. When there was a huge wildfire just in front of the hospital. And that's really frightening because emergency cars cannot longer come to the hospital. Staff cannot come to the hospital. Patients are not able to come. And it really creates a lot of stress. And also trauma. And people are losing their homes when they come back. And you have seen that, for example, in Australia, it's devastating. Then if you see a completely changed landscape. So you're not going back to your old home and rebuild it. It's completely, your whole environment has completely changed. And that also creates a lot of nostalgia. Also, for example, in children when they lose it. Yeah, and an easy thing to do is to tackle air pollution if we really want to do something about climate change. I think that should be the easiest thing to do first, because it definitely also would improve all our health. So also data from the WHO. So we are having at least 7 million deaths per year. And air pollution from cars, exhaust fumes are very toxic. They, in a way, are detrimental to every cell in our body. So to our brain, to our unborn children, to our heart and to our lungs. And it has a huge impact in Asia, as we know, the air quality is there very poor, but also in Africa, because the air quality there also has decreased over the past years a lot. Also mostly related to traffic, but also to coal-fired plants. So there are also different publications on air pollution, and one of it is that it really increases infant mortality, and it's very toxic, especially for children, because they also walk very close to these exhaust fumes, or even in their trolleys when they're pushed through the streets by the mothers, very close to the exhaust fumes, and they have a lung system that still needs to develop. And this is very susceptible to air pollution. Yeah, and that is also some luxury I have experienced when I moved to Kigali, how great it is to have clean air. And I definitely enjoyed it a lot on Hydra to have clean air there. But in Kigali, we have really super bad air quality. And that was also a reason why I now have my air quality data on an app and look it up every day. And I also get notifications. And these are the data I've just want to show you. And these are even good data for Kigali. Mostly the PM2.5 is much higher. And what I want to also show you, for example, that there's also kind of leadership in this figure, because you'd see Beijing. Beijing is really known to have super bad air quality, especially during the Olympics. And they really have cleaned up their city to have cleaner air. And I've monitored it if it just was a one day example, but it's pretty good. And it comes from a lot of sources, also in Rwanda, from deforestation, wildfires, from definitely a lot of really bad exhaust fumes, charcoal burning, and we are going to hear a talk this afternoon about the impact of charcoal burning and indoor air pollution. Yeah, coming now to something we can also act on, net zero healthcare. As I've mentioned before, we are all in that journey. So we are not outside. We are also contributing to climate change. And we all need to act on that. And as healthcare professionals, we have quite a high carbon impact in our healthcare system of 5.2%. And the main emitters are the United States, China, and the European Union. And within the European Union, it's Germany and Switzerland. So in a way, we also have to reduce our carbon intense healthcare system, because even after COVID, it increased. It was 4.8 before, and now it's 5.2. And we also need to stop that. And this is also something we need to learn and we need to accept. So more CO2, more carbon intensity doesn't mean better health care. And I think a perfect example for this is, for example, the US health system that is very carbon intense, but the health outcomes are not great. And for example, you see it in infant mortality rates. And so we need to move from this resource-intense healthcare to quality healthcare. And that's something that also needs to happen in our brain. Yeah? So we have to think and consider healthcare in a different way. So our goal should be to have a more integrated, smart and lean healthcare approach, that not everything is done in parallel. Yeah? Patients, we are as pediatricians act a bit differently, but all our other disciplines have a problem with that. So that we integrate healthcare system in hospitals, but also outside in a better way. And the new paradigm is to have improved healthcare within planetary boundaries. And we have to move in that direction that's indicated here. So what can we do? That's also another topic. You can lecture quite a bit on it, and you also can engage in it. And there's also group attack at the WHO. You can also look it up on the website. That also gives advices what you can do as a healthcare professional, as a CEO, as a head of a hospital, as a passionate medical person about it. And I've done a bit about transformation in hospitals and transforming hospitals, and you can achieve quite a bit within a short time frame. So one of it is, for example, engaged in plant-based diets. There are also very nice programs in Europe and in the States about it. And you also can improve the health of your patients. If you really stick, for example, if you do not want to have a completely plant-based diet, then you should stick to the recommendation of having only meat twice a week. That's a current recommendation. Nobody, I think, really adheres to those recommendations, but it's good for our health. It reduces cancer. It reduces a lot of side effects on heart, kidneys, and other body systems. Then there are also the possibility to have low emission inhalers, powder inhalers, and do not take other inhalers that have other substances. Then the operation theater is another subject. They reduces a lot of resources, and most of the resources, energy-wise, but also waste-wise, is really used in hospitals and in the operation theater. And if you engage in operation theaters, also nurses do that, to reduce the resources there and really see and streamline that, a lot of resources and CO2 can be limited. Anesthesia is another thing. Desflurane, for example, stays in the atmosphere for 25 years. So if you, for example, switch from to more intravenous anesthesia, it also saves a lot of CO2. And there are also guidelines. You can look them up on the internet on green operation theater, for example, by the Royal Society, or low carbon anesthesia. And then there are also initiatives about circular healthcare, that you do not always use something and throw it away and create waste, but reuse it and think how you can reuse it. And our current system that was implemented the last, I think, 15, 20 years, that we use a lot of single-use plastic items also in medicine, is really not sustainable. And we also need to rethink that process. And if you do it as a team, you can really achieve really nice outcomes. Yeah. Then there are also definitely action from the leadership of a hospital. So you cannot act without leadership of your superiors and of the head of the hospitals. So, for example, cycle to work is something that you can engage your employers with. In some cities better, in others it's more difficult, but it's possible. Then also the option to have free public transport available for hospital employees is also something you could engage them. In the States, they did it in that way to engage people to use public transport in some hospitals, that they made parking so terribly expensive that that people think, oh, I should rather take the bus or the metro to get to work. Community gardens is something that's happening, for example, at the NHS in the UK quite nicely. So there's a lot of engagement also with communities, also to getting communities into the hospital and hospital management. And it's really integrating healthcare on both sides. That's also the next point, to have more integrated healthcare with communities, that, for example, your healthcare doesn't stop at the hospital, that you really reach out, do outreach, and attract the healthcare that's provided in the community. Digital health is an option, but also not the solution, because digital health is also quite energy intense. We have to be aware of it. So that's not the healer for everything. But I think it was very nicely applied during COVID, also by the NHS, that people didn't need to come in to a hospital to get treatment or to get advice. So there are definitely good solutions that need to be thought about, and you need to think about what can be applied to make it effective, and not thinking that digital health is a solution to our climate crisis. And lean healthcare solution. I think that's the most difficult part we are facing. So when we treat a patient, we really have to think about what's best for the patient. So not what's best for the hospital and for the financial situation of the hospital, but what's best for the patient. And does the patient really need the MRI? Does the patient really need another X-ray? Does the patient really need the lab examination? Does it really give me valuable information that I need to make his life better? And these are things that are really currently not educated and not taught in our curriculum. That's another question. So we are talking about the climate crisis and climate change for 120 years. The first publication was in a British journal. It's published in 1897, sometime, quite describing what's currently happening. And why is it so difficult to accept or to change or to do something or to see the changes? So what we really have to be very conscious about. So we are really fighting against a very wealthy and influential lobby. And that's a fossil fuel lobby. And you can also look it up. There are also several publications now about the impact of fossil fuel companies really inhibiting change. And they influence everything. They influence policymakers, but they also influence the media, but they also influence scientists. And they are also creating this myth about wind turbines that disturb our life and animal life, and about electric cars. And it's all a myth that is created and makes the change to more sustainable living very difficult. And even the Lancet has very nicely put that phrasing, the health at the mercy of fossil fuels. And currently we are at the mercy of fossil fuels. And the fossil fuel industry is even impacting our climate talks and climate conferences as COP, as we have seen over the past years, and we'll see it this year as well. So who are the states that could change, the governments that could change a lot? So if we would have some leadership from some states, it would help us a lot. So you could just, you can count emissions in various ways, per capita, but per country, and historical. You can also count in historical emissions. So definitely United States, China are the top emitters, then European Union with Germany at the top. But then there are also other ones as China, Canada, Japan, and a couple of others, but also Saudi Arabia and all the countries that are producing oil. So there are 5 pillars of climate change denial, and we see it. Sometimes we feel it. It's getting more and more. So there is a science denial, the economic denial, the humanitarian denial, and there's a definitely humanitarian aspect because we have more and more migration due to climate change, because people have to find better living, and there are more and more conflicts about it. We have the political denial and the crisis denial. And there's quite a nice publication in Nature that you also can look up and read about it. Yeah, and then there's also the notion that's happening currently in our media. And we also have seen a lot of setbacks regarding climate activism over the past years, also from governments. And then you think, are they too strict? Are they too confrontational to act? But if you, for example, see it from the lobby, for example, what the farmers did in Europe, in Germany, in France, that was much more confrontational in comparison to climate activists. But it was much more accepted also by the media and even by the population. But there's also some, glimpse of a maybe positive development on the horizon. Climate litigation is really increasing, and the cases for climate litigation are increasing and are quite successful. And I think that was this wonderful case in Switzerland where Swiss pensioners brought up a case at a very high court in Europe. And it was a ruling that climate and not acting on climate change and on the Paris Agreement is a human rights violation. And that happened not long ago. It was in April this year. And that gives us some hope that there is some progress in this area. And what we also shouldn't forget, we also need to have climate justice. So we must make it accessible for all. And there's also the UN Youth Office working on it to create a just transition, to have a movement to cleaner energy and sustainable energy, and also integrated advocates, for example, from indigenous people, because they are really keepers of our natural biodiversity. Yeah, what we have also done, for example, we really engage with patients also about climate change when we do consultations. But we do not only communicate with patients, we also give lectures, for example, to parents and our colleagues. And the question always is, how can we do it? And as we have to act, all have to start and act on climate change. There are some ideas how you can do it. So in a way, you really have to know your audience. You have to talk differently if you talk to children as to talk to other parties. Then you shouldn't expect too much knowledge about climate change. It's really interesting. We are talking about it, but it's not well known what's really happening. The facts are not known. And there was a study published 2 years ago, and they compared high-income countries. And the worst knowledge about climate change were in the States, in Germany, in Italy, and UK. And when you look what's happening from the political side, that I think explains a lot. So when you talk to people, just explain the basics, probably not in depth, but don't expect too much knowledge. Then we have to become an expert in our field and also make it tangible. So talking about polar bears doesn't affect and touch anybody. So you really have to tell your story and tell your story that's relevant. And you can also find advices at the IPPC or at Yale, the School of Environment, how to do it. Yeah, and that's the question that remains for us. What now? What do we do? What do you do when you leave here, the lecture hall? What can we do about it? Talk about it. Do not be silent about it. Really related, for example, things that's currently happening in Florida to climate change. And that's not a natural disaster that's happening and nobody knows why. And then we also have to play our role in electing really climate sensitive leaders. And it's really a pity that climate change is so political because it affects everybody of us, yeah? And every group and every income group and everywhere. Create awareness in your environment. And I've always experienced when I create awareness, there are lots of people who are really grateful that people are talking about it and that they can exchange with them. Be active. Do something about it. It's good for your mental health. Yeah, and really connect climate change to health. And for most health professionals, interestingly, it's not well known that climate change really relates to health. I also met a health professional on the journey and said, oh, is there a connection between climate change and health? I didn't know. So really just connected to health outcomes. Yeah, and to end with Charles Darwin, it's not the strongest of the species that survives, nor the most intelligent. It's the one that's more adaptable to change. And that we will see if we can really change. So I would just end with the following conclusion. We need to deliver healthcare within our planetary boundaries. This is a challenge. Our neo-economic models of healthcare based on the more technical, the better vision are not sustainable within our ecosystems, health systems, and societies. Net zero with continuous decarbonization of our healthcare system is a priority for all of us, but also the establishment of lean, low-tech, integrated healthcare models, and we have to work on that. Planetary health should be an integral part of our medical education, that students that we are teaching nowadays understand where we are heading. And we need to be the change agents. And we have, and that's a new narrative. There's so much we can gain and so much we can lose. And I would like to end. Tomorrow is today and begins first as an idea in each and everyone's mind and soul. Thank you very much for listening.